Good afternoon, Pete here. Today I just want to quickly discuss and research the idea of the future of um, mental health diagnosing in the counseling field. Um, my personal impression from working as a tech and doing my practicum at the local CCBHC called the Guidance Center here in Fort Smith. Um, my current impression is that we are not in a good place when it comes to diagnosing, and we need to get into a better place. And what does the future of mental health diagnosing look like? So, what they would do is they would do a comprehensive diagnostic assessment, which takes forever to do. I did one as a part of my practicum, and it takes forever. I wasn't confident in it, and I'd imagine that I could get a better diagnosis just asking questions, following my gut, and it's systematic in a sense because you have to ask certain questions that it prompts you to, and it's always the same questions every assessment, but it's non-directional, and so it's systematic in more of a shotgun sense of you're just gathering as much data from as many fields or you're gathering very little data from as many fields of questions as you possibly can to just try and come up with a diagnosis for your client. So I want to ask, is systematic diagnosing possible? And what I mean by that is, can we make it repeatable and consistent in its accuracy of diagnosing as well? The idea is you'd be able to do the same thing over and over and get really sharp results by doing the same technique. So my first resource, my first link is this article to the Keiser University. And they basically are outlining counseling assessment, and they list three types of assessment, which is questionnaires, rating scales, and clinical interviews. So clinical interview is kind of what I was just describing. I've also administered rating scales like the PHQ-9, GAD-7, suicide risk assessment. I think it's the Columbia Suicide Risk Assessment, and the questionnaires are interesting too. Kind of remind me of things like personality tests, for example, or in ABA they have an assessment called a motivation assessment or something of that nature, where you figure out what most motivates an individual, and that's also interview style or questionnaire style as well. So the thing about these assessments is they're all very specific. PHQ-9 is a depression scale. GAD-7 is an anxiety scale. Columbia Suicide Risk Assessment is a suicide risk assessment. And so the idea is, like, is there any way for us to broaden out our assessment and go from where you're looking at a wide picture of someone's symptoms to the most likely diagnosis every time? In a systematic manner where you can repeat it. So right now, I don't think we have something like that available to counselors, and obviously it's hard for us to. We won't be able to be the ones to even produce that information if it's possible. We're kind of relying on psychologists when it comes to research and assessment, or advancements in that field. So what is our future? And what is the assessment at its best? And I think diagnostic assessment at its best is probably neuropsych evaluations. And so I have a link here for you guys, that's basically an introduction to neuropsych evaluations, and the amount of information that they cover in a neuropsych evaluation is unbelievable. But they're very, very good at finding specific diagnosis for you, determining the difference between one disorder or another. They're really good at finding neurodevelopmental disorders, for example, like ASD or ADHD. They're really good at distinguishing between borderline and bipolar, which is really hard sometimes. And So neuropsych evaluations are really good, but they're really comprehensive. They take 4 hours, 5 hours. Sometimes the psychologist will break it up in 2 days or something like that. Um, and and so it takes not only a lot of knowledge on the part of the psychologist, it takes a lot of different kinds of assessment. They're assessing your cognitive your psychomotor skills, for example, or they'll assess your academic skills. Um, let's look here. They assess your memory, your intelligence, your mental processing speed, um, your verbal functioning. So it's very comprehensive, and they work really hard to get down to the the specific causes and diagnosis behind your symptoms, basically your symptomology. So obviously, a counselor isn't going to do that, but I think it's worth noting it is done, and it's done on a high level. And is there a way that we can raise our level of diagnosis closer to that? Does that mean we do more assessment, for example? Or I think the field is probably leaning towards integrating AI. So should we use AI? Is that going to work? We want to get systematic diagnosis, and we want to get it sharp, and we want to get it timely. And is AI a good option for that? And so my last article, and probably my most important article that I'm linking to you guys, is basically the American Counseling Association's official opinion on using artificial intelligence for assessment and diagnosis. So, and we can talk about a couple of my takeaways and a couple of their takeaways. But basically, the first question is, why would we use AI? We've kind of been through it, but right now we're stuck in this working diagnostic model where within an hour you just get the best idea you can on a diagnosis, and then you just kind of reevaluate every session, basically, the diagnosis. And in my practicum, I had heard a counselor or two basically say you kind of figure out which diagnoses you can throw on, and some diagnoses require less evidence, and there's kind of this finesse to diagnosing where you almost just have a few that you work with, and so these are the ones you put on the chart, and you keep everything else in your own mind, which kind of put a bad taste in my mouth and made me ask, are we really trying hard enough to diagnose people? So would AI be able to fix that, I guess, is the question. Would AI be able to provide us a symptomatic way to go from broad symptomology to specific diagnosis? Because you can start with depression, but then it's like, okay, you're experiencing depression. Depression could imply major depressive disorder, but it could also imply that it's a symptom of how many other diagnoses? At least 12 probably. You know what I mean? Maybe 20. So we need a systematic way to start with, okay, you're feeling apathetic, to this is your diagnosis. It's comorbid, or it's distinguished from this because of this reason. So I guess the first question is it possible for AI to do that? And I think a lot of people would argue no. I think the hardest problem is people don't come to a counselor and share their symptomology. They don't bring you a list of symptoms. It's not like going to the doctor and saying, well, I had 102-degree fever, I had 101-degree fever. I threw up, It's like they come with a story. They want to tell you their story. And so it takes more personal finesse because you're going from a story to a diagnosis, not a list of symptomology to a diagnosis. And so you have to infer and interpret and figure out what the symptomology exactly is based off of what your client is saying. So it's possible that AI may not even be able to grasp that. AI can remember all the symptomology and could definitely systematically use a list of symptomology to find the most likely diagnosis, but it can't pick up on vibes, basically. And like I said, they don't come in with a list of symptomology, but also sometimes it's a vibe, and there's a human aspect of understanding the way that you said that wasn't right. Your influx in your voice was wrong. Your emotional um, affect is off, and uh, that's the type of thing that AI couldn't pick up on. You might be able to tell just in your gut someone's being deceptive, and you don't know why, but you know that they probably are. Or like, especially like with borderline, you may not even be able to put it into words why you think they're borderline or why you know, but you can feel them trying to pull your attention out of you and try and get you to care about them and just get that thing that they need from you, and trying to pull it out of you, and you can just feel that. But it's harder to put into words. So, uh, is AI able to cover that gap? So, it would probably take teamwork between man and AI, because we need to basically use those vibe checks to make the symptomology. And then maybe once we make the symptomology, AI can help us figure out the diagnosis from there. So the ACA is a little nervous about cultural insensitivity and bias issues with AI, but there's not enough research. We don't really know. Like, they say AI could cause more or reduce bias. We don't know, but you should be careful to see if there is bias changing in regards to how AI is approaching the issue, or the client. And so the other thing is AI. Can AI be culturally sensitive? And there's some debate on that. The ACA thinks that it can, and encourages more research to be done on how to make AI culturally sensitive. Some people would lean away from that, like, how sensitive are you going to be to which cultures, basically? And if you're too sensitive to the wrong culture, well, the wrong culture. If you're too sensitive to one culture, it could imply you being less sensitive to another, if that makes sense. So, um, because cultures aren't always integrating well with each other. So, um, that's why we have issues with tribalism and wars and things like that. So, how can you be sensitive to all cultures, if you will, without reducing sensitivity to other cultures? So, really interesting questions. I think AI is the future for counselors, because we can't do it on our own. We rely on psychologists for assessment, and we can't do it anymore. We got to take it into our own hands. So I don't know if that is going to require newer AI or more creative use of the AI that we have. So, really interesting stuff on what's going to happen, but I think we need to change. I think we got to get better. So, good luck to everyone. I hope you wrap up your semester well, and I hope that everyone can get a little something out of this to help them with diagnosing later on. So, thank you.